Yes. I'm
Okay.
sorry about it.
Okay. Never mind, yeah.
Technical problem, I think.
Technical
I was
problem,
working a
but
while ago.
yeah, will be solve this problem as soon as possible.
Yeah, I have
So
already sent the lecture to Intan.
okay, okay. Thank you very much.
Mm.
And the operator, can you share about the materi? Okay, Mr. Ryan,
Yes.
uh, what are you busy now in the Philippines? Maybe now during a pandemic, you still going on hospital or uh, work from home?
Oh no, I still go to the hospital
Uh,
at least Monday to Friday.
Monday to
And
Friday.
the hospital is my work from my house is around 2 hours
2 hours.
drive.
Oh, so
Yeah,
far.
2 hours drive. So it's like Jakarta to Bogor, something like that.
Jakarta to Bogor. So every day you
Every
going to the
day.
hospital. The
Yes, every day because uh right now we are experiencing a lot of understaff because many nurses
hmm?
already went to the US and many migration there. So only few were left here in the Philippines.
In the Philippines. Okay.
Yes.
Uh, can I ask about when you meet with Nurse Hasim?
Mm-hmm.
When you meet for the first time with
First time,
Mr. Hasim
I
I think
think
it was Apetna.
it
in
was
Apetna
Am I correct?
yes, in Bogor.
In
in
Bogor.
Bogor. Okay.
We both still young at the time.
Oh, Hasim.
Very nice city, Bogor. I like it there. Indonesia is like also second home to me because I've been to
Oh,
Indonesia many times.
many times going to
I've
Indonesia.
been to Solo, to Jakarta, Bogor, and these are all about for lectures. And I'm happy that my Indonesian brothers like you are good friends of mine and also are active when it comes to handling this type of wounds. And this is a good move actually by your society and by Hashim because diabetes and wounds must be collaborated together. They should be uh, connected to each other because most of the time we just only look at the wound but not the whole patient itself. So it's very timely because I'm going to share to you what we are doing here in the Philippines and in my hospital, in my institution with regards to this problem.
Okay, okay,
And I'm
okay,
happy that my slides are already okay.
okay,
I'm sorry
okay,
again. Okay.
okay. The topic or the material is has already. So, Nurse Ryan, the please to deliver the material. The time to presentation
Okay.
is 13 minutes and continue with the
Question and
discussion.
answer.
Yeah, discussion or Q&A. More or less 15 minutes. Time is yours.
Okay. Thank you very much. Again, I would like to say sorry and apologize for the technical difficulties that happened a while ago. I would like to thank again the society and the organizing committee for inviting me over. Of course, I would like to thank Hashim, and I would like to congratulate the team for this wonderful event and a very successful event. I'm also happy to see my friend and my brother, Dr. Hari Krishna Nair, who's been we've been working together with a lot of things for quite some time now, and been also around doing what we wanted to do, which is wound care. Next slide, please. So my topic for this morning is about the collaborative approach on managing, of course, diabetes and a patient who has a diabetic foot ulcer. And we've been hearing a lot about diabetes this morning, and I'm so happy to see and to listen to Brother Eddie, who discussed about the psychological aspect and the spiritual aspect when it comes to handling patients with diabetes and also patients with wounds. Next slide, please. Now, these are just my normal disclaimers that the contents of my presentation does not really affect the opinion of my institution or my current affiliations, but basically more on my personal opinion based on my personal practice. They are scientific discussions only, as we are conversing right now and we're exchanging knowledge and facts. There might be some images also of patients and people in my slides, but they are used for educational purposes only and does not breach the privacy law of the Philippines, no, when it comes to data privacy. Because here in the Philippines, people are very sensitive when it comes to taking photo, sharing their names, their cell phone numbers. There's a law that has been passed that you cannot give the number or photos without any consent. So you have to make a consent. Next slide, please. So we've been discussing diabetes this morning, the whole morning, and diabetes is a metabolic disorder wherein, of course, we know that it is because of the increase in blood glucose level over a prolonged period of time. And there are actually three types of diabetes. Type 1 diabetes, which is insulin dependent, type 2 diabetes, which is non-insulin dependent, and of course, your gestational diabetes, which occurs during pregnancy. Now, your diabetes type 1 is also known as your juvenile diabetes, no? Because they are commonly seen on younger adults to teens, no? To young patients. No? And most of the symptoms that we see to patients with diabetes is, of course, excessive thirst. And we know that you have a high blood sugar when you take your glucose meter. You have sudden weight loss. You have fatigue. The wounds would heal definitely slowly because of some factors which I will be discussing later. And of course, it may also include blurry of vision. And actually, diabetes has many, many complications. That's why in our institution, at our diabetes center, we're really more on the preventive side of treating patients with diabetes. Or even if you are just have been diagnosed to have a probable diabetes, we will having you treated in our center with some of the preventive methods. And I will share it to you. Next slide, please. Now, while discussing wounds and in correlation with diabetes, how does it affect our wound? No? So basically, because of diabetes, the blood flow is affected, and we all know that wounds, no, to be able for it to repair fast, for faster regeneration of tissues, it needs a good blood flow, it needs good circulation, it needs good oxygenation. And because of diabetes and high blood sugar levels, it prevents nutrients and oxygen from energizing the cells. And it also prevents your immune system from functioning efficiently. And that's why most of the time on the area of the patient that has a diabetic foot ulcer, it can either have a vascular problem or a neuropathic problem. No? So neurological and neuropathy, meaning doesn't feel anything on that part because of the complications of diabetes. And it also increases the inflammation on that body cells. No? And most of the time, because of that, infection would come second. Next slide, please. Now, when it comes to the epidemiology here in the Philippines, diabetes mellitus is ranked 8 to 10, no? Leading cause of mortality in the Philippines. That is according to our Department of Health. And diabetes affects 347 million people worldwide, and it is estimated to affect 380 million people by 2025. This is according to the World Health Organization. But I guess the one that Dr. Hari presented earlier is a much more updated one. And in the Philippines, about 1 out of 5 every Filipino, no, approximately we have 11 million diagnosed of pre-diabetes and diabetes combined. And I guess I'm included to that. No? I'm also a diabetic person. Most of us have that disease. Next slide, please. And it is because I think of the lifestyle and the culture of the Filipinos. For a diabetic patient, no, the lifetime risk of person with developing a foot ulcer may be as high as 25%. And in here, in my personal experience in our practice, I think most of the patients that we have is very common is a diabetic foot ulcer rather than a vascular leg ulcer or an arterial leg ulcer. Now, Filipinos like to makan, no? We like pedas, no, spicy food. We like also sweet food, no, and it is a culture wherein we enjoy eating food together with the family. No? It's one of the way that connects us and binds us together, and that is why I think one of the reasons why diabetes is very high. Next slide, please. Now, diabetic foot ulcer, as we know, is of course a partial or full thickness wound that may be seen commonly on the ankle of the foot, no, or at the foot area. And we need to do certain diagnostic tests to really identify those things, no, and to be able to do certain procedures to that patient. And it is also commonly described as having a callus formation around the wound area. And again, most of the time, patients who have neuropathy doesn't feel that they already have a wound. And most common story of patients who have diabetes here in our country who have developed such injury is that they already have a nail punctured on their foot, no, on the kaki, with the injured already, but they don't know until they see that it is bleeding or it already has an infection. Next slide, please. And very common that at least lower limb amputation is one of the most chosen treatment option even up to now here in a modern country, in a modern culture. Still the practice is not being well managed when it comes to limb saving because they are always thinking of saving expenses, no, financially. Because here in the Philippines, most of the hospitalizations are not covered by the government, no. They are covered personally by the patients, by their own pocket. So in spending a lot of treatments, instead of spending a lot of treatments, a lot of money in treating diabetic foot ulcer, most of the time the doctor would just say or would prefer an amputation than to a prolonged treatment. But of course, in our hospital, in our institution, we are now promoting limb sparing and limb saving. So until such time that the patient says so, that he doesn't want to have his amputated leg, we will not amputate, no, those leg, and we will try to do modern management of or modern wound care as much as possible. And it is said that when you lost the limb, no, you had an amputated leg, most probably in 5 years' time, the other leg will come with it. Next slide, please. Now, there are many factors that contributes to the delay in wound healing, and this is according to Lori Sweezy. This is a good diagram wherein wound heals, no? Basically, it is a biological cascade, a process wherein even before times our wounds heal, no, without even treating it. But there are factors that delays wound healing, and that is why we're treating wounds in the modern way. And those factors include, of course, age, no? The age, the elder you became, the more older you became, of course, your wound healing is slower. Poor nutrition, comorbidities like diabetes, venous insufficiency, And the pressure and friction would also contribute to the delays when it comes to wound healing. Taking of medications, for example, of course, and also our lifestyle. And having a diabetic foot ulcer would be evidenced by the following symptoms. If the patient can still feel, no, there's a tingling or burning sensation, or in some there might be a loss of sensation until such time that they would only see that there's a wound presence on that area. There is persistent calf pain, and there is also swelling. And as much as possible, it is best that we advise to our patient that if they have seen such symptoms, they would go to a specialist or to a nurse that treats wounds like this as soon as possible. Next slide, please. Next slide. Now, diabetes, a collaboration of treating patients, backward please, a collaboration of treatment for patients actually is that treating patients with diabetes should be holistically approached, no, and multidisciplinary. Meaning that there must be a communication between the patient, the doctor, and the wound center or the wound specialist. No? In our practice, the patient definitely goes around to the diabetes, endocrine diabetes and thyroid center, and also to the wound center. And if there is a need to refer the patient to other specialty to make it faster, the wound healing, and in a more effective and evidence-based management, it would do so. Next slide, please. So meaning diabetes can be treated as on a bigger perspective. We should involve everyone. There should be a lot of people involved to manage it and to make it holistic, no, and much more faster. That is based on our experience. So just like this one on the diagram, a patient comes to the diabetes center or to the wound center. And when they go to the diabetes center, definitely the endocrinologist there is treating the patient's diabetes. And by doing so, there are some preventers that we do so that the patient won't be having a problem in the future when it comes to foot ulcers or to any other complications of diabetes. Next slide, please. Next slide, please. Now, this is a common process flow that we have wherein the patient goes to the diabetes center. And then when the patient goes to the diabetes center, automatically a foot exam is done to the patient or a diabetic foot assessment is done. And then check if there is a wound or not. If the patient doesn't have any wounds, we will do a foot care planning to the patient, and would also do foot education. If the patient have wounds already, they will be referred to the stoma and complex wound care clinic for treatment. And if opted by the patient, we will send a nurse to their homes, or we will do home service or community of care. Next slide, please. Now, the diabetes program, uh, you can see here, is a collaborative function. Actually, it's a same program that we adopted, the same program that the Jocelyn Diabetes Center in the US is having, and our programs were accredited by the Jocelyn. Now, you can see here that when a patient has a diabetes, it's very important that we do screening. And we have certain screening that is customized to every patient. No? So it's customized, and it would determine best when it comes to the diagnosis of the patient. It would be having lesser diagnostic tests done, because most of the time, most of the doctors, when you go to the doctor, a patient goes to the doctor and would ask for consultation, they are asked to do certain tests. And then sometimes we find out that those tests are not essential. Now, by doing this program, we have identified certain tests that I will tell you later on that pertains to the relationship of the diabetes to the patient. We also focus on the future complications that would happen to the patient, like for example, diabetic neuropathy, nephropathy, no, diabetic foot ulcers, and other cerebrovascular disorders. And we consider diabetes as a special service. We also give diabetes education. We have different modules that we give to our patients that is customized in accordance to their need. Next slide, please. Now, this is the diagnostics and screening test that we do to our patient who goes to the center if they have diabetes or they are in suspect of having diabetes. The most important thing is we have this diabetes education modules. Now, we have actually 6 modules. Consultation to an endocrinologist or to a wound specialist, fundus photography, food assessment, lifestyle assessment and management program, or what we call the LAMP, diabetes chemistry panel, GDM screening panel, no, gestational diabetes, complete diabetes panel, and of course, we have your ACTH stimulation test. Next slide, please. Now, when it comes to the diabetes chemistry panel, these are the following tests that are very essential in treating the patient's diabetes or in diagnosing patient's diabetes. At the same time, we were able to identify any problems with those certain tests. We can target the problem and we can do the management in accordance to the medication that is needed to the patient and also the type of treatment that we're going to give to the patient when it comes to the patient's food. So on the diabetes chemistry panel, it is included that we do your fasting blood sugar, your ALT, CBC, uric acid, HbA1c, creatinine, lipid profile, urinalysis, microalbumin, and creatinine ratio. And if needed, we also require for the patient to do a chest X-ray and an ECG test. And that is because we know that common complications of diabetes would include, of course, your cardiovascular and respiratory system in the future. Next slide, please. Now, our diabetes nurse educators are very essential in also conducting this program. This center, the Diabetes Center, is a nurse-led center wherein they are the key players when it comes to running the center and operating the center. Now, the diabetes education modules are being done by these nurse educators, and they are certified by the Philippine Society of Endocrinology, Diabetes, and Metabolism. So they are well equipped and they are well competent enough in talking with people who has diabetes or people who are newly diagnosed to have diabetes. And I am really fond of the lecture done by Eddie a while ago because this is the most important thing that we thought that should give focus, no, by our educators and also by health professionals like us or the nurses, because most of the time patients with diabetes have many misconceptions about diabetes. No, they would eat sweet foods, and then later on they would say that I will just eat fruits to balance everything. Wherein it is not. Even the fruits are sometimes have a lot of sugars that can cause your blood sugar to go up. Next slide, please. Now, what are the different diabetes education modules that we should give to the patients with diabetes? And this is again in correlation with treating the patient to balance their blood glucose level, no? And at the same time, your wounds will be having a difficult time of healing if, of course, you have a high blood glucose level. So we are conditioning the patient to have a normal life by having a normal blood sugar level. And these are the different modules, no? Getting to know diabetes, the truth about insulin, no more worry-less, the change of face of diabetes, especially in the children and teens. No, we focus also on the children. Gestational diabetes and also managing your diabetes daily in special situations. No? So these different modules are customized to different ages of patients, different situations, and of course, their different social living and daily living that they do. Next slide, please.
Sorry, Mr. Ryan.
Yes, sir.
The time 5 minutes ago,
Okay.
presentation. And
Okay,
then
thank you.
we continue about the discussion or Q&A with
Okay.
the all participants. Okay.
Okay, thank you. So we also do diabetic foot screening. This is again a mandatory procedure for patients who are diagnosed with diabetes. Next slide, please. So these are the different procedures that we do for diabetic foot assessment, and these are manually done by the nurses. No? Next slide, please. Next slide. So included is, of course, podiatric care, nail care, callus removal, orthotics, education. Next slide, please. We also have offloading shoes and offloading soles, different soles that is used by the patient. Next slide, please. Now, why do we include photography as a diagnostic test? Because this is to determine if the patient would be developing future complications such as cataract and glaucoma. Our lifestyle assessment and management program was developed together with the psychiatry department to assess the different and behavioral changes and adaptation of a newly diagnosed patients with diabetes. No? Most of the time, we find out that patients with diabetes and suddenly you change their diet and their lifestyle, they undergo depression and they develop depression, unfortunately. Next slide, please. Now, we also have included nutrition counseling wherein the patient is referred to a professional nutritionist or dietitian for the diet modification and, of course, for the food counseling, nutrition counseling that is given to the patient. They are given a sample nutritional daily intake for them to go home, and also with regular counseling for the patient. We use telemedicine nowadays because of the pandemic. Next slide, please. Now, because of the challenge of elective surgery now, because of the pandemic, of course, OR surgeries are on hold. So most of the time, we do autolytic debridement and enzymatic debridement. In the Philippines, we don't use maggot therapy yet because of the FDA approval, and it is not yet accepted in the Philippines. Next slide, please. So the new normal, of course, online teleconsult with the doctor and with a wound specialist. If the patient will be going for or undergo a OR surgery, a swab test is necessary. And then, of course, a surgical debridement. And then after surgical debridement, a continuous visit to the center is done. Next slide, please. Now, when it comes to the change of dressing, we opted to do, because of the situation nowadays, so use dressings that would promote more or better absorption that you can use longer to the patient, because they won't be going to the hospital more frequently. So foam dressing or negative pressure vacuum therapy is advised to promote better healing on a longer period of time than daily dressing. Next slide, please. So these are the common methods that we have on our protocol when it comes to using dressings. We use primary dressings which would take care of the infection and the bacteria. Secondary dressings on top of the primary dressing to take care of the exudate, and of course the tertiary dressing to protect the dressing that we apply to the wound. And of course we know that there's all sorts of dressings available now in the market. Next slide, please. So it is also important that we emphasize to the patients that they should also check on their foot regularly, check on the different signs and symptoms of infection. If as much as possible, always maintain a hotline available for the patient and the relative so that they can call the hospital or the institution anytime. And these common signs and symptoms, I think, is well familiar with our colleagues here. Next slide, please. So taking care of infected wound is very important because infection would basically delay wound healing. And in here, in the Philippines, we're very strict when it comes to the algorithm of giving antibiotics and taking care of infection. So it is suggested that you do a culture beforehand before giving antibiotics. Should consider also taking antibiotics systemically and using antimicrobial or a antibacterial dressings on top of your wound. Next slide, please. So now, because of the pandemic, most patients opted to do continuity of care or home care. And that's what we're doing now. Everything is online, online book and pay to promote, of course, the continuity of care for patients that the pandemic is not a hindrance on going to the hospital or taking care of themselves when they have disease or diabetes. And they should continue on taking care of themselves also. And their health provider is always available, even this time of pandemic. Next slide, please. I think that would be all. I am supposed to show a video, but because of the technical difficulties, I think I will just do it next time, or we'll just do it on the Q&A. Thank you very much. That would be all. Thank you for your attention and your time.
Okay. Thank you very much for the good explanation for the fourth material in how about the collaboration approach to manage blood glucose in patient with DFU, diabetic foot ulcer. Baik, rekan sejawat sekalian, tadi sudah dijelaskan mengenai penjelasan tentang pendekatan kolaborasi, ya, bagaimana kita memanage glukosa darah pada pasien dengan diabetic foot ulcer dengan ulcus diabeticum. Dan beberapa penjelasan tadi yang sudah saya catat adalah mengenai bagaimana diabetes chemistry panels, ya kan, dan juga tadi sudah dijelaskan mengenai diabetic food screening, ya. But I'm a very interesting Nurse Ryan, yeah. When you explain about the holistic approach for diabetic foot ulcer. And I want to ask about how to apply a holistic approach to patients with diabetic foot ulcer during pandemic. Okay. Because the holistic approach is very, very difficult in pandemic era, because many stressors and very, very difficult to apply that. And then how to apply the approach, holistic approach for the patient during pandemic.
Okay. Thank you very much for that wonderful question. And actually, during the first time of the pandemic, during the first surge, it is really difficult, no? Everything changed all of a sudden in just one click, no? Just like Thanos, the Avengers. Just one click, everything changes, no? So the patients all of a sudden were gone, and the hospital is filled with COVID. No regular cases. COVID cases were focused first and foremost. They are the ones that are being attended. But what about the patients who just have a normal problem, non-COVID, but wanted to go to the hospital? And that is the main issue. That is the main problem. Second, to be holistic, you need health workers, right? You need other specialties also. And these specialties, most of them, most of the doctors, most of the healthcare professionals also cannot go to the hospital because of the pandemic. Now, the thing that we have done, the most, I think, the critical move that we have done is to digitalize everything. We went into digitalization. Even paperless transactions were done. Doctors should be informed ahead of time, or the specialist that is involved on the patient care should be informed ahead of time for a team conference meeting, including the patient's relatives. So communication is always available. Another is having group practice methods, meaning if your endocrinologist, there are 5 of you who are a practitioner of doing endocrinology. One at a time, there's only one doctor who goes to the person or to the patients, but you're handling it as a group. So like for me, I can go to a patient even if it is not referred to me, but it is referred to a group. And then we just have just like this, a tablet, or we have a device wherein we can see the patient's data there. But again, these are protected and you have to make a login, everything that is need for security so that the data is protected for the patient. And then you can easily give your medication and your advice to that patient by using that device. And um, it is, I think, our institution has mandated everyone to still go to the hospital uh, as much as possible to have this practice. And then we have separated COVID to a non-COVID area. So we made a 2-in-1 hospital. So the COVID patients receive their normal COVID treatments, different, we call it the new norm. But then the other one, which we're using the holistic, that you're asking me, the holistic approach, is on the normal hospital that we have because it's 2-in-1. So the green zone, when you go to the hospital and then they have identified you on the entrance that you are a non-COVID patient, they give you a green bracelet. So you go to the green zone. If you are a COVID patient, you will go to another place or another entrance, and then you will go to the yellow zone. So that's, I think, how we were able to do it.
Okay, thank you for the explanation about the question. And we know in the pandemic era, it's very difficult to going to hospital. The very patient is difficult. If you want to go to hospital, is they feel afraid with the
fear.
COVID. Yeah.
Yes.
With the COVID. And then I take a conclusion for your explanation is more important how to telemedicine.
Correct.
Yeah.
Correct.
During pandemic is one of the solution during a pandemic, how to care our patient with the telemedicine.
Correct.
Okay, thank you for explanation. And the next question in the chat from the Nurse Ahmad Asimi Bisono. But Mr. Hamka, Nurse Hamka, can I join with us, operator? Maybe after this, Nurse Hamka join with us, Nurse Ryan, because he says something maybe. So the next question is, at the Medical City Hospital, Philippine, what are the follow-up care strategies for the patient with wound after hospital discharge? Discharge, especially about the patient self-management.
Okay.
Please.
Thank you very much. Very nice question also. So the care is patient is admitted, treated after surgery or any other treatments. The patient is advised to discharge, right? To go home. Before discharge, it is mandatory that a wound nurse must go to the patient and give education to the patient's family and the patient. So the wound nurse will do the wound dressing at the bedside with the patient's relative. And then there is a certain checklist that the wound nurse would fill up and to assess the level of independency of the patient and of course the relative as a support group. Because if the patient cannot do the treatment at home or may have difficulty, at least there is a trained relative who can assist the patient. Now, upon assessing and by doing that counseling to the patient before discharge, and it says that if the patient is independent enough or the relative is capable of taking care of their relative, when discharged, there will be given, the things that they need will be given to them. There's no need for them to buy outside. Everything is given to them. The dressings, the solutions, everything is given to them. It's a one-stop shop concept. Now, every time, the nurse, the center will be calling the patient from time to time, every 3 days, every week, depending on the level of independency, to check if the patient and the relative is doing well. Now, about the telemedicine, they are virtually consulted. So they can see the patient, they can see the wound. If there's a need for them to be consulted at home, we will send a healthcare provider at their home to do the care or to reinforce the learning. If they are not independent enough, we will be asking them to go to the center as an outpatient basis treatment, outpatient. So they visit the center. If they are not capable of visiting, they are too far, we have satellite clinics available. The whole Philippines, we have 60 satellites clinics which the patient can go. So wherever they are, those satellite clinics are available. So they can, it's like a mini hospital. So in Indonesia, I think you have many wound centers. And this may act as your satellite clinics. It's a referral system. So for example, I have a patient here in Manila and the patient lives in Bogor. Definitely it's too far. And I would either call a SIM or I would call Widasari to help me take care of this patient. That is called networking, and also it means of satellite referral. So patient's care is not, cut or continuous. There's continuous care. We should always think of the patient's welfare when it comes to the matter. And besides, the patient would be very, very appreciative when they are being taken care, even if they are in the far places. I have an experience before wherein I have a patient who went to Malaysia, and actually I referred him to Hari. And Hari, as of the moment, called me yesterday that he has a friend who is living here in the Philippines who has wounds. So he told that friend, you call Ryan, Ryan will take care of you. So those are the type of referrals. And by doing so, I think it's possible. Everything is possible as long as we are really into it and we put ourselves into it.
Okay, thank you, Nurse Ryan, for the explanation and very, very clear. And I think a conclusion ya, bahwasannya kalau di Filipina itu memang pasien-pasien diharuskan apabila kita tidak bisa langsung ya datang ke rumah, ya, nantinya dapat kita melakukan strategi melalui pendekatan-pendekatan seperti yang tadi disampaikan, yaitu telemedicine. Ya, dan bagaimana caranya adalah bisa nantinya dibuatkan list ataupun table, ya, apa-apa yang dibutuhkan nantinya sehingga nantinya kita sebagai perawat dapat mengontrol, ya, walaupun tidak langsung datang ke rumah, ya, hanya saja kita nantinya dapat bisa mengontrol kondisi pasien secara virtual, begitu. Dan apabila ada pasien-pasien yang mungkin jauh dari daerah kita. Nah, biasanya kalau di Filipina seperti apa yang dijelaskan oleh Nurse Rian tadi, bahwasannya kita dapat menghubungi teman-teman kita di daerah lain untuk membackup ya pasien-pasien yang sudah menghubungi kita, seperti itu. Oke. This is my conclusion. Maybe for the season 5 minutes again. Maybe Pak Hasim.
I think there's a question regards to what if the patient does not want their limbs to be amputated while the ulcer is getting worse from time to time? I would like to answer that question. It was on the chat box. Yes, it happens. There are some patients who doesn't want their leg amputated, even if they have been advised that it needs to be taken off because it's already infected, it's already on the bad stage, there's already osteomyelitis, and really the progression of sepsis is high. But no, by accordance to the Philippine law, if the patient opted not to have that leg amputated, they have the right. And even if it is the family member who wanted to get the leg amputated, for example, the mother and the son wanted to have that leg amputated, if the son is in the legal age and doesn't want that leg to be amputated, we cannot. It is prohibited by law. So even if we tell the patient that you will die because of infection, if you won't have that leg treated or amputated, we cannot do so. But what we can do is to have a palliative care on board. So we will clean the wound to prevent it from infection, keep on doing culture, but until such time that it can only holds on. If the patient is already on the septic or sepsis stage and there is really a need for emergency, then that's the time that you can operate. No, you just have to bring the patient to the hospital, admit the patient to the hospital, give antibiotics and treatment, and then that's the time again that we can counsel. But until such time that the patient is, can think and decide by himself, you cannot without his will.
Oke, itu dia jawaban dari pertanyaan Nurse Yuda Perwira ya. Oke, dan karena waktu sudah habis, mungkin ada permintaan dari Pak Hamka tadi, sudah bisa join, Mas Operator. Oke, one question again, Nurse Ryan. Oke. Selamat siang, Bapak Hamka, CEO NCI Center Kalimantan.
Hello.
Halo.
Hello, Hamka. Good afternoon.
Hamka is very handsome lately.
Hello.
Ryan look really good today with your great presentation. Thank you for contribution to our country. The relationship between Indonesia and Philippines. I have to support you as ET brother, and I have one question for you about multidiscipline collaboration. I remember the first moment meet you in 5 or 7 years ago. You explain your situation as a single ET in your country. Yeah. We have this, and we have separation between Indonesia and Philippines about limitation ET. But your presentation today showed your power to build system and make it speechless for this. So good. In many cases in our country, especially in hospital, doctors still take a full role in wound care with conventional method. Maybe you can share your experience on how to improve competence-based multidisciplinary. I hope you can understand about my question.
Yes. Okay. It's about the competency, right? Competency.
Okay, sorry. Before that, Pak Hamka, mungkin untuk memudahkan rekan sejawat sekalian bisa mengerti pertanyaan dari Pak Hamka, mungkin bisa dipersimpel ya pertanyaan Pak Hamka kepada Nurse Ryan. Silakan Pak.
Nurse sudah bahasa Inggrisnya, mungkin saya kasih tahu teman-teman kalau situasinya Nurse Ryan di Filipina ini sebenarnya cuma sendiri seperti itu. Kita di Indonesia lebih banyak dari mereka, namun kita masih suka gontok-gontok sama tentang perempuan. Karena saya nanya Ryan gimana cara meningkatkan multidisiplin bekerja sama dengan dokter berbasis hospital, seperti itu moderator.
Baik, terima kasih Pak Hamka atas pertanyaannya. Mungkin nanti juga bisa dijawab langsung oleh Nurse Ryan. Dan sepertinya Pak Hasim dari tadi ingin mengutarakan sesuatu ini, sepertinya.
Oh no,
Silakan
I'm good.
Pak
I'm
Asep.
good. I'm good. Okay.
Okay.
Keep going.
Mr. Ryan, please.
Yeah.
Answer the question from the nurse Hamka.
Yeah, very nice question. It reminds me also of what banyak, right? Banyak.
Until now, maybe 200.
200. Philippines. There's dua. There's only dua. And the thing that I think is important when it comes to competency is to collaborate with the doctors and also to other healthcare professionals when it comes to your passion, which is our work, us, our ET. Most of the nurses here in the Philippines would like to go to critical care nursing, renal nursing. They would go to anesthesia nursing, but very few would like to go to enterostomal therapy or wound nursing or ostomy nurse because they have not heard from it. And I think the thing that helped me a lot is to do lectures, continuous education to other institutions when it comes to modern wound care so that I would get their interest. When it comes to competency, of course, training those newly hired nurses that goes to the hospital. I have talked to our institution advisor or the training officer of the hospital to include wound care and ostomy care in the program so that training for these new nurses would come in and they are allowed to refer patients to the hospital, to the wound center when they have a patient who has wounds. And Brother Hamka is also correct that the law when it comes to nursing practice here in the Philippines is very, very strict, wherein there are many limitations when it comes to doing your practice. But I have gained respect from them, maybe because I have shown them my competency. I have shown them my evidence-based practice. I think it works a lot. I show them my patients. I show them my patients' self-sharing. My patients would tell them definitely personally that I have been treated by Ryan. His methods are effective, no? And those sharing of best practices by word of mouth is, I think, much more effective than doing a big marketing strategy. Now, just like Indonesia, Philippines is composed of a lot of islands. And before the pandemic, I used to go at least in a week, every week in an island just to spread the word about wound care and about ostomy care. And hopefully, by that time comes, from 7 years ago, there are many nurses now that are into wound care and ostomy care. And hopefully, there will soon be more in our country. And I salute again the works of our brothers and sisters there in Indonesia, who is really very, very passionate when it comes to this specialization in nursing. And that's why I am continuously supporting also Indonesia. And I would also like to thank Indonesia for continuing giving support. I have my ostomy doll from Widasari. No? She gave me an ostomy pediatric doll that I use to my pediatric patients up to now. And it's still there in the center. And collaboration is very, very important when it comes to our practice. There is nothing wrong in collaborating to other countries. It is also at the same time very, very helpful. Just like Malaysia, Dr. Hari is very, very open and helpful to all of the nurses. No? He is a good ally of nurses and not a very, very helpful.
Oke, pahamkah? Itulah penjelasan dari Nurse Ryan mengenai bagaimana perjuangannya di Filipina ya. Kalau saya tangkap adalah memang sangat-sangat berjuang sekali. Kalau di Indonesia ada kurang lebih 2.000 ITN nurse, but in Filipina just 2 ya.
Dua.
Dua, hanya 2. Oke. Bagaimana Pak Hamka? Ya, karena waktu sudah selesai ini, karena akan memasuki sesi yang berikutnya. Terima kasih Pak Hamka atas support dan pertanyaannya. Sukses selalu, and thank you very much for Nurse Ryan for the
Terima kasih.
opportunity and share about the knowledge wound care practice. And stay healthy, success for your career, and see you on the next event with the Pedis Care Malang.
Thank you.
Thank you.
Hope to be in Indonesia soon also.
Okay, we will waiting for you, especially in Pedis Care Malang. Nurse
Thank
Hasim still waiting. Nurse Ryan come to Malang.
Of course.
Okay. Okay. See
Let's
you.
kidnap him.
Inshallah. Thank you.
Thank you. All the best,
Thank you.
Ryan and
Thank you,
family.
Hashim, brother. Brother, thank you.